Hey, this is Dr. Firnhaber. It's Wednesday here in Lincoln, Nebraska, and it's time for 10 minutes of truth. Now, today I have another dynamic article out of a peer-reviewed journal that I want to share with you that contains a lot of truth about health. The name of this article is called How the Neck Affects the Back. Changes in regional cervical sagittal alignment correlates to health-related quality of life improvement in adult thoracolumbar deformity patients at 2-year follow-up. This is out of the Journal of Neurosurgery, Spine, and it was published in August of 2015. So that's a pretty complicated title, and I'm just going to explain what that means. What they're saying here is that if you take adult patients with deformities or altered curves in their middle and lower back, that the placement of the head on the neck has a lot to do with their quality of life, whether they get better or not, whether they have pain or not, and whether they have disability or not. So let me explain what I mean by that. This article makes a couple of interesting statements. First of all, it says positive or head forward of the sacrum sagittal spinal alignment has been associated with pain and disability. So what does that mean? That means this. If you look at a neck, it's supposed to look like this from the side. It's supposed to have a nice curve, and the head is supposed to fall right on the shoulders. When this moves this much, which is 4 centimeters, all it has to move is that much forward, and this completely alters the patient's health. It increases disability, it increases pain, and it increases the entire quality of health of this patient's life. Just 4 centimeters of forward movement. So what this article is saying is that if you can take a patient who has forward head carriage like this and bring it back to where the spine is now sitting on the shoulders, just bring it back some, you're going to improve that patient's quality of life and the amount of pain that they're in. Now, what they're saying in here is that if somebody needs surgery, spinal surgery, and the surgeon can do the surgery such that they can bring any forward head carriage back, that this patient is going to have much better results with the surgery than they would have otherwise. Now, it says this in the article. It says for all patients, baseline forward head position significantly correlated with increased disability index and pain. For operative patients, patients that were undergoing surgery, forward head carriage greater than 5 centimeters significantly, which is about that much right there, significantly correlated with mental health scores, surgical satisfaction scores, and increased pain scores. So, what do we do? Do people necessarily need surgery to get their head back over their shoulders? Not necessarily. In our office, Lincoln Disc and Nutrition, we do this all the time, and we use a device called a Denerol. Now, a Denerol is a home traction device that people can lay on. Their head falls over the back here, so they lay on it like this. Their head falls over the back. As they lay on it over time, that brings their head back over their shoulders and brings a curve back into their neck. That's how we do it here. You don't necessarily need surgery for that to happen. And what we have found that once that happens, people feel a lot better, their quality of life is a lot better, and they're not in nearly as much pain. It says here in this article, regional cervical sagittal parameters such as cervical lordosis, which is the curve in the neck, were correlated with clinical measures of disability and health status in patients with adult thoracolumbar scoliosis. So adults that have a curvature in their thoracic and lumbar spine, when that curvature causes the head to move forward like this, that causes pain, disability, and even mental, emotional problems. But if you can fix it so that the head comes back and that we can start getting the curve into the neck, that can really change their pain and their health. Well, in our office, we do that through chiropractic adjustments and the use of this device called a Denerol. And a Denerol, like I said, is a very simple home traction device that can be used with people that have problems with the curvature in their neck, that can help support a normal curve in the neck. How long does it take? It can take 3 months, 6 months, maybe a year of using this regularly to get that curve back into their neck. But it's well worth it in terms of their long-term quality of health and disability. So this article states that the more the head moves forward on the spine, the worse that patient's health is going to be, the more disability they're going to have, and the higher pain scores are going to have. When you bring the head back, that increases that patient's quality of life tremendously. And that's what we do here at Lincoln Disc and Nutrition. So I hope that this helps you understand why some of you out there have chronic pain in your back, chronic headaches, a low quality of life, and just the inability to move properly. But if we can fix that head and bring it back over the shoulders and pull your head back away from the front of your body, that's going to make a huge difference in the quality of your life. So hope you learned something today. This is a great article out of a great journal, and hope you have a great and healthy day.